There's a silent pandemic unfolding all around us. It's a crisis that could literally rewind a century of medical progress. The enemy? We call them superbugs. But as this threat gets bigger, a new playbook for how to fight back is emerging. So today, let's dive into India's strategic plan to take on this global menace. I want to start with just one number: 4.71 million. Now, that's not a budget, it's not a population stat, it's a body count. Yeah, that's the annual death toll linked directly to what we call antimicrobial resistance, or AMR. And just to put that into perspective for you, these superbugs are now one of the biggest threats to global health. They're turning what should be routine surgeries into life or death situations, and they're undermining treatments for everything from cancer to organ transplants. So this brings up a huge question, right? How in the world do you fight an enemy that's invisible, that's constantly changing, and is basically everywhere? The answer, it turns out, isn't just about finding some new wonder drug. It's about a fundamental shift in how we use the powerful medicines we already have. To really get the strategy, we first have to understand the enemy. And that brings us to the core of the problem: antimicrobial resistance. The easiest way to think about AMR is like evolution on super fast forward. The more we use and especially misuse our antibiotics, the faster these microbes learn to outsmart them. The source document puts it plainly: this crisis is primarily driven by misuse and overuse. So every unnecessary prescription is basically a training session for the enemy, teaching it how to survive our best weapons. Okay, so if misuse is the problem, then a smarter, much more disciplined approach has to be the solution. And that's exactly what this document is. It's India's national strategy for dealing with a massive national threat. So its official title is the National Treatment Guidelines for Antimicrobial Use in Infectious Disease Syndromes. I know, that's a mouthful. But this thing is so much more than just a manual. It's really a blueprint, and it's designed to completely reshape how an entire nation thinks about and uses one of modern medicine's most precious and finite resources. What's so important to get here is that this isn't just some casual recommendation. This is a unified strategy coming from India's top medical authorities. The main goal is to guide the empiric use of antibiotics. And what that means is it's for that moment when a doctor has to make an educated guess and start treatment before the lab results are back. This playbook is all about making that guess as smart and as consistent as possible, all across the country. So, what does this playbook actually say? Well, it all pretty much boils down to a set of core principles that create a whole new standard of care, a new philosophy of what's called antibiotic stewardship. Let's just call them the 5 rules of prescribing. These guidelines basically create a 5-step mental checklist for every single prescription. It's a simple framework, but it's really powerful. Confirm, identify, reserve, choose, and then de-escalate. So let's just quickly walk through what each of these really means in practice. All right, Rule 1 is all about being a clinician first, not just a data reader. The guidelines really hammer home the importance of a clinical diagnosis. Looking at the patient's history, their symptoms. The first and most important question is always, is this a bacterial infection that actually needs an antibiotic? And you know what? A lot of the time, the answer is just a simple no. Second, you've got to think like a detective. What are the likely culprits for this specific infection in this particular place? The guidelines push doctors to look at local data, these things called antibiograms, which are basically reports that show which bacteria are common in an area and, crucially, which antibiotics still work against them. Okay, Rule 3 is absolutely critical. Save the heavy-duty antibiotics for the really serious fights. That just-in-case prescription, that's not acceptable anymore. Empiric therapy, that initial best-guess treatment, is now reserved for truly life-threatening conditions, like severe sepsis or meningitis, not a common cold. But when you do need to act, choosing the right weapon is everything. It's all about precision, not just raw power. The goal is to use the narrowest possible antibiotic that can still get the job done at the right dose for the shortest possible time. Think of it like a surgical strike instead of carpet bombing. And finally, Rule 5, de-escalate. The guidelines get pretty technical with advice like what you see here, but what it really means is don't use 2 drugs when one is enough. The idea is to start smart and then get even smarter. If you have to start with a broad, powerful antibiotic, you absolutely have to reevaluate within 48 hours once the lab results are in and switch to a more targeted drug whenever you can. So those are the rules. But what does this whole smarter, not stronger approach actually look like in a hospital? Let's check out a couple of really powerful examples that come straight from the guidelines. This is just a perfect illustration of how it works. On the left, you've got acute myocarditis. It's an inflammation of the heart muscle, but it's usually caused by a virus. The guideline? No antibiotics needed. On the right, infective endocarditis. That's a bacterial infection of the heart valves. The guideline? A specific, aggressive, 4-week course of 2 powerful antibiotics. See that? Same organ, different cause, totally different treatment. That is rule number 1 in action. And this table here, it just perfectly captures that whole de-escalation journey. So a patient comes in, they're critically ill. You don't know the cause yet, so you start a broad-spectrum drug, a heavy hitter like meropenem. But then the lab report comes back, it's a specific bacteria and it's sensitive to plain old penicillin, so you stop the big gun and switch to the precise weapon. The outcome is better for the patient, and it's better for the future of all of us. So why does a clinical document for doctors in India matter to everyone everywhere? Well, because this isn't a local issue, it's a global one. Protecting antibiotics. That's a responsibility we all share. The key takeaways here are actually pretty simple, but they're incredibly important. AMR is a massive global threat. Our best defense isn't some new miracle drug. It's using our intelligence. Treatment needs to be targeted and precise. And above all else, we have to start treating antibiotics like the precious, finite resource that they are. You know, if there's one single sentence from this entire playbook that sums up the new era of medicine it's calling for, it's this one right here. Necessary. Definitive. This is the standard we all have to start demanding, as doctors, as patients, as global citizens, if we want to protect our future. The age of wonder drugs gave us a century of health and safety that was unimaginable before. That inheritance, it's now at risk. So the question that these guidelines really leave us with is a personal one for every single one of us. Antibiotics protected our parents. How are we going to make sure we protect them for our children?